Hello, everyone, and welcome to the Prehospital and Disaster Medicine podcast number 3 for the World Association of Disaster Emergency Medicine. My name's Joe Cuthbertson, and joining me today for the podcast is Dr. Hayley Dieckmann, a vet who has currently and recently published research regarding veterinary care in disasters. The title of the paper is Current Operational Model for Veterinary Care in Large Animal Shelters During Disasters. Welcome to the podcast, Hayley.
Hi, thanks for having me.
Great to have you here talking about this research, Hayley. Before we kick into it, can you tell us, a little bit about your practice and what got you engaged in disaster medicine and veterinary care?
Yeah, of course. I have been passionate about veterinary medicine since I was about 10 years old. It is definitely very much a calling for me. Working with animals and their people has been something that is really just made me feel that I can serve my community in the best way. And disaster medicine was something that I didn't find until veterinary school. But I do think that when I was a child, my home had to be evacuated due to a wildfire. And I think that that also was, a formative experience in my life, and recognizing and being able to relate with communities affected by disasters was something that has driven me to continue to pursue disaster medicine, and have a strong feeling of purpose in that. And so in veterinary school at the University of California at Davis, their program, the Veterinary Emergency Response Team, was something that I got involved with just about 2 weeks in to my veterinary training. And what I found there was that the clinical professors involved, the people that we were able to work with, be that first responders as the fire department, the community members, the response teams. There was an incredible sense of community, and a community that welcomed me openly, and I was able to become very close with and feel that additional research and additional time needed to be put in to make response protocols more streamlined in order to improve our response.
Fantastic. So it sounds like you've really found your community of practice and engaged in that. Can you tell us a little bit more about the role of the vet in disaster response?
Yes, so animals are intrinsic in any disaster, whether that be our companion animals like dogs and cats, or our large animal species like horses and goats and sheep. So what we find is that we need to address this, the animals that are also affected. And in my recent paper, this is focusing on large animals, which is something that proves to have some more challenges, in that veterinarians can serve a critical role in not only providing the resources by which to transport these animals, these large animals, to evacuation locations, but then at these evacuation shelters provide the care required to both treat wounds and injuries sustained while they're fleeing from disasters. And also, large animals, when transported to shelter environments, also undergo significant stress. And that stress can exacerbate medical conditions. And so, the careful monitoring and veterinary care required for large animals not only stems from direct effects from disasters. Predominantly fires have been what I've been involved with, but I think, this could be extrapolated into any disaster. And then also just the management of a shelter and making sure that chronic conditions are not worsened, that stress-related medical conditions do not occur, and also biosecurity measures in order to make sure that the safety of these animals is an utmost priority.
Okay, so your research has focused on an operational model, and in particular, you've now published some guidelines. Hayley, how do you think these are going to fit into future response efforts for disasters, both within the US and within the global community?
I would love for these guidelines to make it a little bit easier for anyone that's responding to a disaster with large animal species to be able to have a jumping off point. In my experience, in a disaster, there's just this amount of chaos, and making some sense of that and having the ability to provide appropriate care to our animal species is something that I'm hoping that these guidelines can help in the future. So we have found in our time serving California and the wildfires there that there are challenges with large animal species finding a location appropriately to house large animals, as well as making sure that the husbandry needs are being met. And in all of our responses, the shelter husbandry staff has been incredible, but a chicken needs something very different from a goat and from a horse. And our husbandry and our care of these species is going to play into their health. So having those things addressed early in our shelter policies is something that I think is a really big takeaway. Additionally, another thing that we found as a challenge that I've outlined quite clearly in the guidelines here that I hope will be of major assistance to future disaster responders is medical health records. Now, sounds a little boring. It is paperwork, but the paperwork is what allows us to identify the animal, the individual animal. It allows them to treat the animal appropriately and make appropriate documentation of those treatments and medical treatments. And then it also facilitates future reunification with the owner. And the owner then has a document that shows the exact medical care that their animal receives, just like if we were to go to a hospital. But these things are often overlooked or just in the amount of there's so many responsibilities when faced with a disaster, and making sure that there are medical records and templates that are easily accessible, I do think is a critical part to making sure that we are providing appropriate medical care to animal species in a disaster.
That's fantastic, Hayley. Like from a personal perspective over in Australia, I've noticed just how attached people are to their pets and their animals and really prioritize their healthcare along with our own in the setting of disasters. So it's brilliant to see this research come forward and really provide good guidance to practitioners in the field. I can see that you're in the US, obviously, and that you've focused on the UC Davis Vert. How does that in particular facilitate training and education for these future disaster responders that you talked about before?
Yeah, so that has been definitely a huge highlight of my time at UC Davis, and something that I'm still actively engaged in because um, what I want is for veterinarians to graduate from veterinary school and have a baseline of what is required as a practicing veterinarian in an area that may be struck by a disaster. So we've created a program at UC Davis called the Students of the Veterinary Emergency Response Team. And that student club is highly active in that there is a training portion called the Special Studies Program. And what that is in addition to our veterinary studies, these students are so dedicated and engaged that they are spending additional time in the classroom as well as participating in hands-on experiences in order to improve their understanding and response to a disaster, and where the veterinary role is, how to provide appropriate care in triage of animal species, biosecurity measures, moving and handling of animal species, and how to facilitate appropriate husbandry in a shelter facility, as well as humane euthanasia. These are really difficult topics, but we find that educating our students is going to be such an incredible baseline and starting point for their future practice wherever in the world they may go. And so having this experience both in the classroom, and then we partner with our local first responder agencies to run mock emergency scenarios where students are able to take the role of a veterinarian, and how that veterinarian integrates into first responder agencies is incredibly important so that we can provide the aid to the animal species, communicate that effectively with our first responders, and then be able to be part of a collaborative response. And so these students are incredible. They have really driven me to work harder because of their engagement and ability to see the big picture of, we are here as veterinarians to serve our animal species, and we are also here to serve our community.
Look, it's great to see that you've invested in that future healthcare workforce. It's absolutely needed, particularly in the setting of disaster response. I noticed that your focus there is in California, and California has seen significant wildfire over many years. And in Australia, we've definitely had our share of bushfire over here too. Do you think you could talk us through, from your perspective and that practitioner focus, what type of trends in illness or injuries you'd be experiencing as a vet, as a vet working in disaster response, and how these guidelines can help facilitate better care for animals?
Yes, so the guidelines that we recently published in your journal, those were utilized in the California Camp Fire in 2018. That Camp Fire was the largest wildfire in the history of California, and had a huge span of destruction, and an incredible number of animal species, were affected by that disaster. These guidelines were put into practice during that fire, in addition to another database, a health database that I created at the time. That health database helped us track the animal species and the medical conditions and severity and treatment required for those medical conditions while we responded to the first 12 days of the California Camp Fire. And that research, recently published in the Journal of the American Veterinary Medical Association, was able to write the species that we treated, the large animal species, and the most prevalent medical conditions that those species experienced. And why I think this is important is because it can lead to having supplies prepared, as well as veterinary responders aware of the health conditions and the guidelines by which to appropriately treat these health conditions. And some really interesting findings that we found in California. And I would be very interested to see if these, would be what you would see in Australia as well. Some future research there maybe. Is that, of course, burns are a highly prevalent medical condition, but also respiratory disease, gastrointestinal disease, and wounds are also prevalent illnesses and injuries in a wildfire experience. So, breaking those down, we did find that certain animal species were more affected by one medical condition. Specifically, our sheep were the most likely to have respiratory illness. I mean, future research has to be done about why sheep and their lungs specifically are more susceptible. But what we did find is repeatable results in the California Camp Fire that these sheep species have respiratory illness when in a fire. Moving forward, severe burns were most commonly seen in our pig species, our camelids, and our avian patients. So that was some really interesting work, whether that be that the housing locations or the fact that these animals are not able to flee as appropriately as a horse or a larger species is something that has been proposed. But we do see that these species develop severe burns that require multiple days of medical care in order to control and treat and cure. And then lastly, we did find that our equine species, or our horses, were most likely to have lacerations or gastrointestinal illness. And what we do find is as prey species, our horses become incredibly stressed. And that stress leads to a gastrointestinal illness called colic. And that is something that needs to be managed both during a fire and also when they arrive at sheltering facilities. So I do hope that this information will allow veterinary practitioners to come prepared and able to respond.
Really good point there, Hayley, particularly picking up on what we're seeing across different countries in this area of practice. And you're absolutely right. We need more research and more collaborative research to be able to inform healthcare workers across all disciplines how to learn from each other and adopt some best practice principles as they evolve. From your perspective, and you've had so much success already, both academically and as a practitioner, what's your future plans around this?
That's a great question. Just like you said, I think more research needs to be done. I enjoy research. I think that that is going to be a part of my future because how I see it is we want to benefit from each other's understanding and each other's knowledge. And publishing is the best way to share that knowledge across the world and to be able to learn from each other and improve. And so I definitely see myself continuing to do some research, maybe finding some funding to come to Australia. I know that the wildfires are incredibly prevalent there, and I would love to be able to participate, to be able to help those communities and also learn from those communities in order to put together some practices that would lead to the most improved welfare and veterinary care for animals. So I do believe research will be in my future. The University of California, Davis has been very clear on their standpoint of continuing to serve our community and through the veterinary emergency response team. And so I do think that my future could be back there helping to lead and helping to educate our future veterinarians. It's something that I think is really important to me. I was actually a teacher prior to becoming a veterinarian, and the teaching amount and being able to effectively communicate is something that I hope to bring to veterinary medicine and disaster response. And so I do hope to get back there at some point. And then moving forward, as of right now, I'm working as a small animal or a dog or cat practitioner to provide the best quality veterinary care I can for the animals in my community.
Well, congratulations with your success to date, Hayley. You've done a great job, and thank you so much for publishing in Prehospital and Disaster Medicine and talking to us today about the research that you've conducted so far. We really look forward to seeing what's next in this space. As I said before, it's absolutely valuable, and we need more evidence to help guide practice globally on this issue. So, thanks for your time.
Thank you so much. I really appreciate what you guys are doing and spreading the word. I think it's incredibly important. So thank you so much for having me today. I really appreciate it.
No problem at all. Thanks everyone for listening. This was the Pre-Hospital and Disaster Medicine podcast.